Sciatica is just a symptom. It's not an actual condition. It's kind of like saying, I have a fever. Well, what caused your fever in the first place? So usually it's an infection. Well, with sciatic related pain or sciatica, we have a lot of things that can actually cause that pain that goes down from the back of the butt and goes down the back of the leg. Sometimes it even goes to the under the foot and into the big toe. And so the first thing in treating sciatica is figuring out why you have it. Is it, one of the common conditions I'm about to name, or is it something uncommon, something that you need a lot of help for from on a medical side, or is it just something that you can come see me? With sciatica, there's a lot of common conditions. The number one condition in which people suffer from sciatic symptoms would be a muscle spasm in the back of their hip. A lot of people call it piriformis syndrome, but we have 7 muscles that rotate our hip back there that can all spasm and actually cause tightness and pressure on the sciatic nerve that then runs down the leg and causes those symptoms. So that's the most common one. It's that thing where like maybe you did a ton of squats or kettlebell swings or deadlifts and you feel like you have tightness in the back of your hip and you also have a little bit of numbness, tingling, maybe burning pain that goes down your leg. That's the number one cause. That one's easy, and that's kind of the approach we're gonna go with today. We're gonna go down that path today of someone who has that muscle spasm in their hip, but is causing that pain. Maybe it refers up into your back, maybe it goes down your leg. But then there's other common ones like a herniated disc in your lumbar spine, which are extremely common. Doesn't always result in pain. A ton of people are walking down the street with herniated disc. They don't even know it. They don't experience pain. But sometimes it can actually cause the pain that goes down your leg. And with that, you want to figure out, do you like flexion or do you like extension? And that might take a little bit more of a guided path than what we're going to offer today. But the things we do today are still going to be beneficial for those people. The next one would be sacroiliac joint dysfunction, SIJ as everybody calls it, or SI dysfunction. That's the joint that's at the very base of your spine. It's where your pelvis and your spine meet, especially with people who are pregnant or have had serious falls on their ass. You can have some of this pain, and it can cause pain that mimics sciatica, going down your leg, but it's actually caused by some inflammation in the joint. Another one would be a hamstring strain. Hamstring strains, the muscle that goes from your butt to behind your knee, can mimic sciatica. It can also cause pain that goes down below your knee or up even into your back. So it's taking a good medical history can kind of rule that one out. Then we have 2 types of stenosis. We have spinal stenosis, which is the spinal canal where our spinal cord goes down, can tighten up or get choked. And when that happens, it can cause pain down the nervous system, so down into the sciatic nerve down the back of the leg. It can also cause pain in the front of the leg as well. That one often gets ignored. That's your femoral nerve. But the sciatic nerve is the one that's going down the back of the leg, and that's the one we're talking about today. And then you have foraminal stenosis, which the foramen are the holes on the sides of your spine that the spinal nerve roots come out of. And a pinch on one of those, so they move as we flex and extend. But if we get bone spurs in those, it can also send symptoms or sciatica down the leg. And the last major one or common one we can talk about is spondylolisthesis, which if these are your vertebrae from the side, one's going to shift forward. It's not going to go that far. It goes anywhere between 25 and 75 to 90% forward. And that's because that's an area in your body that is more mobile. And so therefore you move a lot from the areas that you can move from. If the rest of your spine is immobile and this is the only one that can move, it's going to start to creep forward and forward and forward over time because of the extension that we're trying to get. That one does not like extension. That's going to cause some serious back pain if you go to extend back. Where the others, it's usually flexion will cause some issues with those. Actually, SI joint dysfunction is kind of up in the air, flexion or extension. But then there's uncommon stuff that can cause this too. The big red flag out of all these would be cancers. There are certain cancers, organ cancers and bone cancers, that can send pain down your leg. That, once again, you take a solid subjective as a medical professional and you should be able to rule that out. But you always have that little thing in the back of your mind that says, okay, something's not adding up. And then we go through all the modalities and exercises, and sometimes we say, hey, I think you need to go back to your doctor. But it's super, 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 super rare, but I gotta list it. Another one is actually a herniated disc in your neck. I've seen it a couple times in my 10-year career, not many, but the person had a herniated disc in their neck and it caused pain in their feet. So that's also a possibility. And then we have peripheral neuropathy that's related to diabetes. And lastly, intermittent claudication, which is a vascular condition. Okay, so we have the uncommon stuff, which we kind of just try to rule out as therapists. And then we have the really common ones, which I'd say like 90 to 95% of the time, that's actually what's going on. And today, like I said, we're gonna treat today like it's a piriformis syndrome, or that spasmed muscle in the back of our butt, kind of where our back pocket is. Guys are always sitting on their wallet. They're coming in, they're like, oh, my butt hurts. And you're like, yo, take that like 5-inch thick wallet out of your back pocket and maybe you'll feel better.